In this part, we are going to discuss about scapula and particularly its dorsal surface. So this is the dorsal surface and this is convex. So this dorsal surface is divided into two fossae by this spinous process or spine of scapula. So this divides the dorsal surface. This is the supraspinous fossa, a smaller one, and this is the infraspinous fossa, larger one. Now uh, these fossae are connected to each other with the help of spinoglenoid notch. Now we came to the processes of scapula. So this spinous process is present on the dorsal surface of the scapula. This is the acromion process and this is the coracoid process. Now we came to the spinous process. This is a triangular plate-like projection on the dorsal surface of scapula. It has three borders and two surfaces, and this posterior border of this process is known as crest. So this is the crest. Now this is the spinous process and this is the crest of spine of scapula. Now, as we already know that it divides the dorsal surface into two fossae, supraspinous fossa and infraspinous fossa. So now we came to the acromion process. So acromion process has two borders. This is the lateral border of acromion process and this is the medial border of acromion process, and two surfaces. So this is the superior surface and below it is the inferior surface. Now we came to the now this is the articular surface of acromioclavicular joint or facet for the articulation of clavicle. So this is on the acromion process. Now we came to the coracoid process. So coracoid process is crow-beak's appearance or bent finger-like, and it is the atavistic type of epiphysis. So this is the coracoid process. Now the remaining points are that this scapula has three borders. So as we know, this is the lateral border, this is the medial border, and this is the superior border. So the superior border has one notch known as suprascapular notch. Now we came to the angles. So this is the inferior angle, this is the superior angle, this is the glenoid angle or widest. So below it is the infraglenoid tubercle, and above it is the supraglenoid tubercle. So that's already discussed in the previous part. So we will discuss about attachments in the next part. Thank you.